as far as the sagging, that problem can be addressed relatively simply. Number one, a cheek lift or a facelift can improve some of this by lifting up the cheek. Now the problem is, if this is relatively severe and the surgeon tries to create all of the correction with this, you wind up with what I call lizard lips. And you can duplicate this on yourself by putting your hands right up here and just pulling to the side as hard as you can, and you can see that the lips look quite unattractive. So you don't want to over pull it. You do need some correction if that's the problem, but the best solution for this type of sagging is what we call a corner lip lift. And what that is we actually remove a little triangle right here, and by removing that, we lift all this up by suturing this point up in here, and the net result is that the axis is straight again rather than curved and going down, and there's only a little scar right on the border of the lip that goes a little ways off of it. It creates a straight lip. It's a small, wonderfully successful operation, which can be done under a local. Lastly, deflation. When lips are deflated, they need to be filled. Again, collagen was used for this in the past. We have a number of fillers like Provel, Juvederm, or Restylane that are currently used, and those are my favorite choices. With injection, the key is to not over-inject, so you get a fuller lip, but not a ridiculous lip, because you see too much of that on television already. So Provel, Juvederm, or Restylane can be injected. Another thing that can be injected is fat. That's a little bit more complicated because it requires a second site where the fat has to be removed. And when the fat goes in, not all of it will stay. So there is an initial period where the lips are overfilled for a week or so, and then the fat will come down over time. That is a more permanent solution, but it's also more expensive and has more downtime, since the regular injections of fillers have virtually no downtime. So, in summary, lips are actually rather complicated and have a unique problems. Which can easily be treated. We can treat the lines, we can treat the sagging, and we can treat the deflation. And we also can treat every single individual component. And by my classification, I include the nasolabial folds, these lines which are the filtral ridge, the ridges of the upper part of the lip, the three anatomic parts of the upper lip, the corners, the two anatomic parts of the lower lip, the three anatomic parts of the ridge, the occasional horizontal line here, and the marionette lines which can hang down from the corners of the lip. These can all be treated by knowing exactly what is supposed to be there and what is out of position. This brings us to the end of our tutorial. I'm Dr. Andrew Kaczynski of Advanced Concepts in Plastic Surgery, where art, science, and beauty come together for you. For more information, please come to our website, drkmd.com. Thank you.